Thank you so much, Janet. I'm very happy to be here. And again, my name is Lisa Klein. I am a traditionally trained physical therapist, but that was not so much my interest. I was always interested in more integrative medicine. And I graduated from PT school in 1991, and within a year was taking classes in cranial sacral at the Upledger Institute and started my manual therapy training there. So I trained in cranial sacral, visceral manipulation, and my interest was always in how do you get patients really better from the inside out? And I loved the anatomy, physiology, and mechanics that I learned in physical therapy school, but the techniques I felt were kind of lacking. And as my interest was always in how do you really fix? And I thought in physical therapy school was we can put a man on the moon, but we can't fix a child with cerebral palsy. I thought that was just, not cool. So I spent my entire professional career studying with the top leaders in manual therapy internationally. I've taught nationally and internationally. In 1995 or 6, I connected with the woman who became my mentor, who is a genius, and I have taken over 100 classes in manual therapy. My classes are now part of a university program in Venezuela, a postgraduate PT program, and we are launching a 2-year manual therapy school as well. So I have 3 offices in the DC area. My team only does integrative. And so it's been a very interesting journey because the way that we treat is very different from traditional allopathic medicine, which I think you guys are kind of down with that whole situation. So as we know, what we know as American medicine is allopathic, meaning the problem and the solution come from outside the body. We are integrative, which means that we believe the call is coming from inside the house, and we're trying to figure out what happened to the body that's making it hard to recover from whatever happened most recently. We use a body of work that has about 20,000 techniques. There is a whole world of manual medicine that is used throughout the world. In the US, we're more allopathic again, so the interventions are meds or surgery, which is highly lacking in other things. So we are structurists, and the training that we have is how to feel through the fascia to find where the problem is in the body. And then a huge piece that's missing in American medicine, again, is structure. So whatever happens to your body is affecting the structure of your body as well. And we're going to talk to you today about the structural components of mind-body trauma. This is one aspect of our practice, which is a pretty significant aspect of it. We also see people, obviously, with physical trauma, physiological trauma. So all of these things affect the structure of the body. Are we all on the same train so far? We're all good? Okay, the way you did is totally fine, but I can't. If somebody raises their hand, just cue me so that I can answer questions. So what we're going to talk about is how mind-body trauma affects the body system. Oh, that's better, if that's okay with you, Jeanette. That way I can see everybody. So you have the first handout is the body's response to trauma and options for healing. And this is a lecture that I've given several times. We get a lot of referrals from mind-body practices who work with patients recovering from significant trauma. We work with a lot of trauma patients here. And so we're just going to do, in the 45 minutes, we're going to give an overview of how trauma affects the physical body and how the body responds to that. And then we're going to go over the processing that we give for homework, which is based on a book that was written by my mentor, which is how to connect parts of the body to help trauma move through you a little bit more efficiently. So it's a little bit different. If you guys have heard of the tapping and the EFT, there's some great ways to do this. I like this. It's a little bit easier than the tapping. So we're going to talk about that. All right. So the first handout, again, talks about what is trauma, and how we define trauma is something that happens to your body that you cannot metabolize. So it could be physical trauma, COVID trauma, physiological trauma. If something happens to you and your body cannot recover from it and push it through, it can stick. And so the things, again, that stick that can create other problems, we put that in the category of trauma, like it hasn't just moved through you. All right. In terms of mind-body trauma, there are many categories of this. Somebody yells at you on the street. You may not take that very seriously. But if your mother yells at you every day of your life, that's not so fun. So it's kind of more a matter of how much trauma load are you experiencing in terms of how much it's going to affect you. So we talk about, again, the body system. As you know, integrative medicine is systems oriented, and we are systems oriented. This body system is self-regulatory and self-healing. So when we look at what's happening to the body, we're looking to see, okay, what happened and what did the body do in its response? The body, again, is a very highly intelligent system and is programmed to respond to what happens to it in a way that is predictable. And there are variations person to person for sure, but primarily it's the same paradigm. So when patients come to see us, we start to reassure them that what they're doing is normal. So we look at behaviors, we look at signs and symptoms, and the goal is to figure out, well, why would the body be doing that? So again, in terms of a system, systems always work perfectly. They don't make mistakes. The goal is to figure out why. Why is the body kind of having that as its response? All right. So again, in that paragraph just talks about, again, we're seeing the body as an intelligent system that knows what it's doing. Our job is to figure out the why. So in terms of how does the body respond to trauma, in terms of physical trauma, every tissue will respond according to the physics of each individual tissue. That's the foundation of our physical practice there. In terms of emotional, mental, psychological trauma, everything is coming in through your 5 senses as information, right? So it's what you see, what you hear, what you feel, all that is information that comes into you. Your body's job then is to try and process said information, which it may or may not be able to do. Is that Alyssa? Hi, darling. Hey. So happy to see you. Anywho, so we're about 3 paragraphs or 4 paragraphs down on the handout about trauma. Okay, so basically everything that happens to you that you're experiencing with your 5 senses, you're living that as part of your life. You live life with every cell of your body, and everything that comes in has to be processed and then move through you. So what we're looking at is, how does your body respond on a cellular level to this information, right? What is your body doing in response to that? So what we do is we talk to our patients about how everything that we're seeing that's going on with them, we're trying to figure out, okay, what happened and how did your body respond? All right, so we have on the next page the fact that different organs of the body process different information. It's all about information. And this goes along with Chinese medicine. It also goes along with what we've been seeing with patients for years and years and years. So the adrenal glands will process stress, fight or flight. Kidneys will process fear. The liver will process anger and a sense of will. The heart processes love and hate. The lungs will process grief. The thyroid will process issues around communication. The limbic system, which is that subcortical part of your brain, will process issues around survival. The gallbladder processes issues around self-image. And this is kind of a simplistic way of looking at it. These a little bit more complex, but this is a simple sheet. The spleen processes issues around disappointment in mankind. The pancreas is one of the deepest process areas, and it processes issues involving like life and death, like super serious stuff. The spinal column, we see processes issues of self-esteem, self-worth. Again, this is a short list and it's kind of simplified, but you get the general gist. Whatever's happening to your body, whatever you see, hear, smell, touch, taste is going into your system, and different organs are processing not only physiological information and physical information, but also the energetics of the feeling, if there's a feeling involved in that. So again, information comes in, our bodies are trying to process that information. That information is then sent to the brain. So the brain is a neurological processing center. It's not an emotional processing center. The emotions are processed from the neck down. All right. As that information is loaded up, it will be eventually sent into the brain, either into the frontal lobes or the limbic system, to be analyzed and then responded to. All right, so this is not the Lisa Klein view of trauma. This is the polyvagal trauma theory. So this is based on a ton of research and sources that this is kind of common knowledge here. All right, so our emotional reactions to situations are determined by our wiring and the amount of load in that system. So everything that we do with our clients is based upon load. How much physical load have they experienced? How much physiological load have they experienced? How much emotional load have they experienced? And can they move those loads? So patients have symptoms and signs when they hit load failure. So what we're looking for is what happened and how do we start decreasing these loads immediately. All right, so information is supposed to be ending up in the frontal lobe. Frontal lobe is the center for cognition, organizational understanding, judgment, right? But there's a ton of research that when all of these organs are overloaded with emotional information, and we're going to talk about how this happens in a minute, information starts going into the limbic system instead of here. And that's how people start having these very significant reactions that are irrational to the situation. That makes sense? We've all seen this. We all drive around DC. We know exactly what this is like, right? We've all experienced this possibly today. Okay, so what happens is when the system becomes overloaded with information, like a bathtub overflowing, you have a trauma cascade and tissue starts to lock down and starts to become facilitated. It starts to become activated. So this is what we're talking about in terms of what happens with emotional, psychological trauma, can also happen with physical trauma. And again, these pathways are well known. And what we found, again, the body of work that we use started with physical issues. And then we realized that if you are working with physical issues to the level of manual medicine that we use, you're going to hit some emotional loads at a certain point. So a whole body of work was developed for treating those emotional loads. And it's kind of gone on from there. It's super interesting. All right. So what we're looking for is that too much emotional information or information that was damaging enters the body system. The appropriate organs are overwhelmed and cannot process the information. The body will become overwhelmed. The first thing that happens is the adrenal glands will start to load and go into a stress response. You go into fight or flight. That will also lock down the respiratory diaphragm and put you into a fight or flight reaction. Does that make sense? This is waking up in Washington every day. This is turning on the news, you know, how it goes. And an election season, how fun is this? All right, so your body's responding to what you're seeing, what you're hearing on the news, you know, that information is going into your whole body. And then again, at a certain point, your adrenals are just like, what is happening? You know, fight or flight, diaphragm locks down. This is a adrenal modulated stress response. There's just too much to be happening here. So what do you do about this? Well, this is polyvagal theory. You have to talk it out. So in order to get this to move through you, you go to the gym, you exercise, you take a walk, you do some deep breathing, you talk to your friends, talk to your spouse, you draw a picture. You have to get that energy moving out of you so that it can be dispersed. It has to be disseminated, differentiated, something. So far, it has to get out of your system in some way. Okay, right? However, if that doesn't happen and this continues, there's a very important nerve that goes through the diaphragm with the esophagus. And all the nerves are important. All the cranial nerves are important, but some of them are really important. And some of them have also gotten a PR agent the last few years because everybody's talking about it now. And that is Mr. Vagus nerve. So Mr. Vagus nerve has a ton of branches, and one of the branches goes through the diaphragm with the esophagus, and it innervates your digestive system. How fun is that? Right? This is the pit of your stomach when you watch CNN. All right. So if you have the adrenals are loaded, the diaphragm will lock down because it shares a vascular supply with the adrenals. That will start to clip on that vagus nerve. All right. The vagus nerve will then start to go into a central nervous system, autonomic nervous system, unhappiness state. And what will happen once the vagus nerve is smooshed, it will start to produce what's called a freeze reaction. So it's a dorsal vagal. So a different part of the vagal nerve becomes activated, and that puts you into a freeze. So they've done a ton of research about people on airplanes and what happens if they, I mean, they don't do this, it's in a, controlled environment. And people go into fight, flight, but they didn't count on how many people go into a freeze state. They just lock down. And that is your dorsal vagal nerve. The nerve is like, I'm out. This is also disassociation. So people who have been in a trauma state for quite a long time, Elvis starts to leave the building. All right. Your awareness is like, it is not safe to be in my body because there are a lot of emotions in there that I cannot metabolize. And I'm going to start going up into my head. All right. So these are people who become separated from their own experience because of the level of trauma, and they start to go north into their heads. No blame, no judgment. This is how you are wired. So your body is wired to start to pull you out when it's too dangerous to be in your own body. All right. If this continues and the system becomes more and more loaded, that's when the limbic system becomes activated. All right. So it's kind of like a silo, filling with grain. You have emotional information. It starts to lock down these different organs. They become overwhelmed. The information can't be processed. Adrenals are loaded, diaphragms loaded, vagal nerves loaded, and then you keep going, and then the limbic system starts to engage. So what is the limbic system? The limbic system is the subcortical, one of the subcortical structures. It's considered to be a very important part of the brain that's there to protect you. At this point, the person is kind of in shock. The system's like in shock, essentially, because it's like the person's starting to numb out. The person's disconnected from their own experience. And at this point, again, new information as it comes in is not going to the frontal lobe. It's going to the limbic system. So your emotional reactivity starts to become driven by a survival crisis instead of whatever's happening to you at the moment. And you've all experienced this or seen people do this. This is a full-on trauma response. All right, this is the definition of PTSD. Your system is now in a facilitated, wired situation. So when this occurs, the person will start to exhibit various limbic system modulated behavioral strategies. The system is desperately trying to get stable. And this is something that is individually, people do this in different ways. These are not personality characteristics. These are survival crisis created limbic modulated defense behaviors. And this is a short list of them. So affectation, confrontation, guilt, shame, victim, martyr, self-pity, self-righteousness, self-judgment, narcissism, judgment of others, rage, guilt, addiction. These are all paradigms of behavior that are in the category of the system desperately trying to seek stability. So we get a lot of referrals from the Center for Relational Recovery in Leesburg. They're a trauma-based addiction center. Recovery place. They're not inpatient. They do everything outpatient, but they get a lot of referrals from Karen and from, what's the place? Hello. In Arizona, it'll come to me. So there is a whole philosophy of addiction and, all of these that's rooted in trauma response. So your body's basically, or your system's desperately trying to get stable, but it's doing that and seeking out one of these behaviors. So when patients come in and they're projecting on us, they could be projecting on the admin. We see these behaviors. We're like, okay, we give them this handout. We're like, look, we get it. You've had trauma. You're not going to be projecting on us. It's more like we need you to start understanding how your system is reacting here. There's nothing wrong with you per se. Your system is doing something to try and get you stable. All right. So again, these behaviors are all considered to be part of the system's desperate attempt to somehow survive an abusive or otherwise traumatizing situation. These are limbic system controlled behaviors, and they can persist after the abuse or trauma is over. This is these behaviors are an indication that the limbic system is now in control. These behaviors, again, do not automatically stop once the trauma is over. So addiction is modulated by the insula, which is part of the limbic system. And again, so we look at what kicks somebody into these different responses. So the question is, okay, how do you heal from this? So there are a lot of different ways to get things to shift. And one of the things about it is you need to start going in, again, we go in through the limbic system. Like, okay, we need to get that to start to be defacilitated to get the person back into, so they're processing information from in the frontal lobe here. There's one thing that I keep forgetting to add in here, which is kind of good to know. So the limbic system, by definition, is irrational, symbol-mediated, sensory-driven, and nonverbal. So when people start making very irrational decisions, when they're seeking out sensory, feedback, whether it's drugs, whatever it is, all the dopamine stuff, right? When they have a hard time talking about what's going on, those are indications that the limbic part of the brain is primary. You cannot talk someone out of a limbic situation. So I have a client now who had extreme trauma as a child, and she's on the table. We're working, she has a therapist, obviously, and we're working to kind of get all this, stuff out of her body. And when we work with her, we're trying to get her to flood her body with a color. My treatment table has a biomet on it. So she's on literally a table of amethyst crystals. So it's like, all right, we need to create a safe environment so that you can start feeling in every cell of your body what it feels like to be safe. Does that make sense? So with our patients, when we work with them and again, to calm down a limbic system, you have to give sensory cues. You have to give symbol cues. You have to give tactile cues. You have to give some way to help them to start to realize that they're safe and to bring them out of a survival crisis. So you can get them back in their bodies so they can have access to all that information that needs to be processed. So this is why the work that we do works really well with talk therapy. And there's some great trauma. This town is full of really good trauma therapists. So EMDR is great. So the goal is you have to get the trauma moving and out. But you also have to get the person back in their body so that they can actually access that trauma and then assist them in moving it out of their system. So that is something that we do quite a bit of in the practice. Thankfully, a lot of these parts of the body that are processing the trauma love to be treated. The adrenals love manual therapy. The adrenals sit on the kidneys like little hats, and they're pretty accessible, and they love, love, love attention. They love to be drained. The vagus nerve loves to get treated. So the work that we do is a little bit unusual in the US. It's much more common just because our roots are osteopathic in Europe and South America, which one of my classes are part of a university program in Venezuela, which is kind of funny. But we're not so touchy-feely in the US. So for us, we're touchy-feely. We're touching patients the whole time. And to put your hands on, which is what I'm going to teach you in a minute, tactile stim can override whatever information put them into a trauma response in the first place. So what we talk about is if it happened and it created this response in your body, we can put hands on and create a construct to get that out and to reset you. All right. So our philosophy is that if something can happen and hurt you, then something else can happen and help you. And love and care are infinitely stronger than anything else. And no matter what happened to you, there should be a way to get that out of there. Because your body is a system, it responds to input. All right. So a lot of PTSD trauma response is because your system was brainwashed into kind of a shitty situation. And our job is to re-brainwash you into a much happier situation, which is you are loved, you are cared for. Again, flooding with that is so powerful. And the goal is to be like, okay, whatever happened to you, let's get it out of there. And then again, talk therapy is great. Talk therapy can be a little challenging if the person is fully in a limbic paradigm. That's why some of these brain-based therapies are better for implicit memory. So, EMDR, there's brain spotting, there's some really good stuff that is a little bit more brain oriented. And then our role is we get it out of the body. So we work on, let's reset your vagus nerve. Let's drain out your limbic system. Let's get your adrenals where they need to be. Let's open up your diaphragm. Let's basically reset the neurobiology of what's going on with you. And what we found consistently is patients who work with us, I'm not trying to pitch my practice here, but like people don't understand the power of touch on the body for healing. It is extraordinarily non-emphasized in American medicine, and it's really not good because it's so powerful. And we have access to the patients we do because the therapists are like, what did you do? You know, you progress faster, you're doing better. If you can get the patient help on all these different areas, the patient will get better faster. And our complete philosophy is the same as a lot of trauma therapy, which is like, yes, things can happen, terrible things can happen to people for sure. But we know how to get that out of there. So if it can happen, it can be made to unhappen. Your body is responding to the trauma in a very highly programmed way, which is normal. And the goal is just to be like, okay, let's make that unhappen. Not to minimize what can happen to people by any stretch of the imagination, but we refuse to believe that people have to get stuck there. It's a very uncreative way of looking at patient care. So on the handout, so we talk about manual therapy. We're going to go over the home processing now. Biochemistry, so there's a lot of supplements and homeopathics that can really help support all these organs. So the adrenals, people work on adrenals all the time, vagus nerve, stomach, limbic system. There are a lot of things that can be used to kind of calm that down. A few of them are listed here. Meditation is one of the best ways to get the limbic system out of a survival crisis response. The limbic system modulates between spiritual ecstasy and survival crisis. So every person walking around the streets of Washington in an election cycle, like spiritual ecstasy, survival. Where do you think we are today? And you can't be in both places at the same time. It's a continuum. So the goal is like, I'm going to give my system as much experience in spiritual ecstasy as I can to brainwash myself out of a survival crisis. Right? That's the goal, is to get over to the spiritual place, right? So that'll kind of bring you out of that. All right, so you have the second handout, and it says neurofascial processing. So this is based on a book that my mentor wrote called Body Wisdom. The foreword was written by Peter Levine, who is at the Meadows, that was in Arizona. It's one of the top trauma, it's like an addiction, trauma-centered addiction recovery center in Arizona. And so what we found is that the body responds to tactile information, and you can use this to help move things out of your body. All right. So if you go to the second page of it here, it has a list of what we call process centers. All right. The first one are the ureters. So the ureters are the tubes that go from your kidneys to your bladder. The ureters drain fluid. That is their job. So if you put your hand, and you can use the back of your hand across your low back above like your butt, but like below your ribs, you're putting your hands across the ureters. Yes, you have muscles there as well, blah, blah, blah. But the most important things there are those tubes that go from the kidneys to the bladder. All right, so if you put a hand on those ureters, and you put a hand on, we've got frontals next, so we'll go there on your frontals. What you're cueing your body to do is you're saying, drain this. All right, so one of the things about manual medicine that is sometimes hard to wrap your mind around is that your body responds to tactile stimulation, which you all know. Right? When you don't feel good, when you get a hug, like this is well documented. But you can do this in a way that actually is therapeutic by giving your body this access. And with the tactile stim, you're trying to override whatever information loaded the tissue. Does that make sense? All right, this is super basic. And we've done trials with this with patients of mine on EEG machines like neurofeedback. Like this works. We've been using this for years. And it's almost like one of these things that's so simple. It's like, how could they do anything? But it's extreme. This is all my patients do this for homework. The handout that you have is the emotional one. We also have one for physical processing. All right. So what we would have the patient do, let's say they're it's a kid with ADD, right? That's all from the frontal lobe. So we're like, you're going to have your hand across the frontal lobe and then the ureters. And we want to hold that for about 20 minutes, which seems like a long time, but it really isn't that long. And it should be relaxing if there's something going on here. All right. And generally the patients tend to be like, oh, that feels kind of good. So what you've got here in your handout are the different areas that are the main processing centers for emotional trauma. So number one, ureters to drain. Number two, frontals. So thoughts, judgment, behavior. The goal is to get the person back into their frontal lobe so that all of their reactions come from here and not from here. Right? Rational thought. This is irrational. Okay. Number three, frontal nasal junction. So this is an access into the limbic system. The limbic system is actually subcortical on the side, but we can get it through here. All right, this is a really nice one. So the limbic system is the center, for survival, and what it produces is rage, which is not technically an emotion, it's an energy. All right, so a rage response is like, none of us have ever felt that driving around Washington, have we? Super common. All right, so here, and then again, you would put fingers here and your other hand would go on the ureters. And you're like, okay, we need to calm this shit down. Let's bring this down a little bit. All right, so by having the hand there, you're working to basically drain some of that heat out of the limbic system. Number four is the top of the head. So parietal lobe. Parietal lobes process feelings and sensations. So like if I have somebody come in and they say, well, my whole body hurts, we're like, let's go for the parietal lobe because you have a systemic thing going on here. Let's calm that down a little bit. All right, so thyroid is the front of the throat. The throat generally is about self-expression. So it's a nice area to process. The heart, which is central in the chest. All right, so the heart is the money. So the heart's pretty much the most important thing that you've got there going on. It's a great area to process for kind of calming down, love, hate, all that good stuff, opening up your heart. There's a whole philosophy that there are personality vectors in the heart. There's a ton of neuro in the heart, vagal nerve, through the all kinds of stuff going on in the heart. So the heart's a really nice one to process. And if I have a client who has a hard time reaching their low back, I'll have them process everything to the heart instead. Because you can't go wrong by bringing the heart in, right? So if this is too hard on your shoulder, or if it's just hard to hold, then you would take everything to the heart, which should also help. All right, number 7 is the lungs. So the lungs are on each side of the heart. The lungs, these are a major big one for grief and sadness. That'll get you right in the heart and the lungs. The spleen is on the left side of the middle ribs. So we kind of have a hand there. The spleen is an interesting organ. It produces antibodies and red blood cells and stuff, and it tends to be active in things like disappointment in mankind. It's kind of an interesting concept. The liver, number 9, is a humongous organ. It's a very, very large organ, and it processes, well, keep in mind, all these things also process positive things. We're kind of giving you the things you want to move out of you, but all these have a counter. They're not all bad, obviously, but we're trying to work on what needs to be processed through. All right, so the liver tends to hold anger. All right, so for rage, we go to the limbic system, and for anger, we go to the liver. All right, pancreas, you kind of have your fingers around your little belly button there. So right in the middle of your stomach. Or not really stomach, that's above it. But anyway, middle of your belly. All right, again, the pancreas is really, really one of the deepest processing centers. It works with issues that are shocking on the level of humanity. Is it critical not to break contact? No, you can break contact. We shoot for at least 20 minutes because that's when things start to really cook. But if you need a break, that's fine. And then just go back to it. But you'll notice that the more you do it, the more it's actually doing something. All right, you're creating a circuit in the body to say, we need you to do this. We need you to amp this up a little bit. All right. Anyway, so pancreas, you tend to see when the person has witnessed things that are truly shocking. I've treated EMTs who had pancreases that were just a nightmare. again, with anything going on, do I have manual therapy videos? Yes, we do. So we have a whole YouTube channel that has, during the pandemic, we shot a bunch of videos of these. So yes, if you, they might still be under Total Health Physical Therapy because we changed our name. But I can send the links over to Jeanette. So yes, we have videos. So anyway, so the pancreas, you know, if somebody gets pancreatic cancer, that's usually like, you know, very significant. So the pancreas is retroperitoneal. It is part of the superhighway of health with the liver and the duodenum and the spleen. It's the immune bridge between the spleen and the duodenum. So it's a bridge between your immune system and your GI system. So for the pancreas to fail, you've had 10,000 failures before the pancreas fails, which is why it's so hard to treat. But it's a very deep area of processing. So we see a lot of patients who have had trauma or seen trauma. We had a whole bunch of women who were the descendants of Holocaust survivors. We called them the hanky-pankies. They were all Jewish women who had very loaded pancreases because that stuff is intergenerational and will hit you a couple of generations down. It's fascinating. All right. Kidneys are in the back and they're your lower ribs. So you get them with the back of your hand, or you can have somebody else help you process them. And they process fear. So we process the kidneys a lot to bring somebody out of fear. And then we do prostate or uterus. So the lower pelvis, that's sexuality, kind of like first and second chakra, kind of root chakras. And then upper arms is kind of control over self-control, and lower arms kind of holds your belief systems, which is kind of interesting. So what we do is when we are taking a client who is recovering from trauma, abuse, whatever, we see, okay, where are we? Again, we have one woman who is on the table. She's not catatonic. She's more like in almost like a DID process of the trauma. So we're trying to get her out of that safely. And so for her, we work on the limbic system because we're trying to get her back in the body. And people, again, get driven out because of the level of trauma. So we know we're going to have a lot of emotional load when we bring her back in. So we're prepping that as well. And then we use that vagal nerve as the runway to bring them back in. So you have to reset the vagus nerve. And most often the vagus nerve is not enough stimulated. It's usually getting smooshed in the diaphragm. So we're trying to reset the crush on the vagus nerve, which comes out from the neck. So there are multiple areas to work on that vagus nerve to kind of calm it down. We'll have patients ice the back of the neck often to calm that vagus nerve down a little bit. And they also do the emotional processing. So we're at 2:45. Jeanette, so I just wanted to give time for questions or how you want to. Or if I'm going to keep talking, I can do that too.
What did you say the emotional aspect of the adrenals are?
Oh, thank you. She just posted the link. Excellent. The emotional aspect of the adrenals, so they process stress, like they put you into fight or flight. So they sit on the kidneys like little hats. Okay, every part of your body has regulators around it that are telling your whole system, are we good? Are we good? Are we good? Are we good? What's wrong? Are we good? Are we okay? Are we okay? Constantly, your body always, are we good? Where are we? So the adrenals sitting on the kidneys like little hats are like, what's happening? And when they load in with information, they will literally load in and they're like, oh, problem. But, and they start to put you into a sympathetic kind of fight or flight paradigm. Does that make sense?
Thank you.
Sure.
So friends, if you have a question for Lisa, feel free to unmute yourself or type it in the chat window. We have a small group so we can be intimate.
Lisa, could you explain a little more about the difference between self-treatment and your doing the same work on the body?
So, right, we have 20,000 techniques. So when we're working on you, we are resetting your adrenals. We have blueprints, template. I mean, we're not just putting our hands on and processing. Right. We're doing myofascial release. We're opening up the vessel. We're treating, we're doing care. So the hands-on thing is the homework. And then what we do is we basically we basically work to treat, which again is an odd concept in the US, but the adrenals, they need to be reset. There's a tremendous amount of work that can be done on the adrenals to get them back to functionality. The whole goal when we're treating, no matter what tissue it is to get the tissue back to neutral. So we're working on the structure, the circulation, the kidneys. There's autonomic nervous system tissue all around that celiac plexus. What's the blood supply doing? What's the diaphragm doing? So we're like little general contractors who we work on that tissue. We're electricians, we're plumbers, we're drywall specialists. So we're like, okay, what happened? What do we need to do?
And now
I do it. I'm on the Zoom call, getting ready to make a statement in a minute. I just left the spa. How you doing? Good. Wait, am I? Wait a minute.
You're okay. So the name of the book is called Body Wisdom, and my mentor, her name is Sharon Weiselfis G. Mateo. So this is all in that book. And then calming the vagus nerve. The vagus nerve is one of the most comprehensively big nerves in the body, and it gets loaded when it's smooshed. So what we try and do is deload the smoosh on the vagus nerve. And there are very many areas where it gets smooshed. The primary area is in that respiratory diaphragm. All right. So what we work on is how do we free it up? It's called a nerve crush. So it comes out of the head here on each side of the spinal cord. There are branches that go into the dura, through the ear, into the face, all the way down. There's a branch that goes around the aorta. So what we work on is calming it down. So one of the best ways to calm down a vagus nerve is to ice it, believe it or not. One of the cheapest, easiest ways to calm down any nerve is to cool it.
Yeah.
So we have a lot of our patients, we have them ice their neck. The stomach does not like to be iced. So we usually don't ice the stomach unless somebody has a full-on stomach cushion, but which is a concussion of the stomach. So otherwise we have them ice across the back of the head. You can ice across your eyes. Is really a nice way to try and calm down that autonomic nervous system.
And your neck too.
Yes, the neck is very, at the neck.
Lisa, I want to say, this is Lynette. I'm very happy to hear your presentation today. You've really confirmed a lot of stuff to me, because about 4 months ago, I had an emotional, psychological, and mental trauma. And it hit me, all of the vagus nerve and everything hit me at once, and I couldn't sleep the whole night. And it took me almost 2 months to process what had happened, why my body was reacting the way it was, and what I needed to do to heal it and get it out of my body. And hearing what you said, now, I didn't come to a professional like you, but I practiced, meditation and massage and swimming and Tai Chi and a lot of self-care. And I did body massages in the fascia area all over the body. I wasn't calling it a draining system, but I probably was draining because I was tapping. I was tapping all over. And I'm just so appreciative of your presentation today, because it showed me that I went through something, but I was able to come out of it.
That's awesome. Good for you.
Thank you for sharing that information today.
You're so welcome. So someone asked, how do we treat through massage? We don't treat through massage. We treat through myofascial release. So massage is great. Love massage, full on for massage. But if you want to actually change the function of a nerve and change fascia, you have to actually treat the tissue the way it's meant to be treated. So we do myofascial release, and we have a whole way of myofascial release on nerves. So when nerves are loaded for a long time, there's scar tissue inside the fascia of the nerve, around the nerve, and all that has to be reset. So we reset the fascia of the nerve. Do Wim Hof type showers work as well to calm the nervous system? Yeah, they're kind of aggressive though. So with my clients, they wouldn't not, that's kind of, they're yes, but so with my clientele, we have them do localized icing and then an ice foot bath. Most people, again, I'm not against it. Like, I've experienced it. It could be great, but it's a little bit aggressive. So you can try and do the same thing at home with an ice foot bath, where you put your feet in room temperature water and you add ice until you can't take it anymore. And you try and reset your whole system through the feet, because you have all those nerves in the feet. So that could work. Alyssa, do you have another question? Because I feel like we kind of cut you off when you were mid.
Oh, yeah, and I'm sorry, I can't believe, I had so looking forward to seeing this. I can't believe I was late. It relates to whether you've told everybody all of the types of things you do, because you've been focusing on one aspect today. And I just wondered if you did that during the first 15 minutes.
To do what now? When do we do?
Describe the scope of the types of issues you treat.
We treat everything that we kind of couched today for mind body, but we treat newborn to geriatric. We do full body rebuilds. So we Lyme, COVID, POTS, post-concussion, chronic pain, like tinnitus, whatever. We do full body rebuilds. Again, we work with a body of work that's like 20,000 techniques. So nothing can escape us. And we never give up. We're tenacious. So yeah, so the whole team was working with neuropeds, which is one of the most difficult populations to work with, and then on adults. And then with this level of information, you run into emotional loads and you're like, we need a body of work for that too. So we kind of, and then I've been in DC for over 20 years, and I don't know when it was. I've had patients send in people who had high trauma, and the results with those patients were like, oh, this stuff works with that too. So we kind of got to be known as working with people with trauma. So we get referrals from the Viva Center, from different therapists around town, and then a fair number in the Herndon office for the Center for Relational Recovery, because they work with addicts. So yeah, so we've seen a lot of really good work. The manual therapy is hugely phenomenal. And again, it's something that's really not that known in the US, unfortunately. So we're working to change that. It's all of our stuff we're doing. Thanks, Alyssa.
Lisa, is that where Klein Institute comes in?
So yeah, so I've been
Talk
teaching.
about the Institute?
Yeah, so I've taught for a long time. I was teaching for my mentor, and then everything kind of fell apart in 2010. And then I was asked if I could still teach on my own. Turns out I can. So I started teaching the information, but in a more systematized way in terms of how we use it in the clinic. So we have a 16-module training series that we do through my office. We've been going with different names. So we landed on Klein Clinical, which is not a great name. And then we're skewing to Institute because I had taught in Chile years ago, and one of the people from that class is a brilliant therapist in Venezuela, and he had created all these manual therapy track post-diploma programs at his university, and we're the 6th track, and our stuff is so great, and they're getting such great results that we're blowing it up into a 2-year. We're going bananas. So he is finally able to come here from Venezuela next week, actually, for 2 weeks. Which is why I might not be able to be a book club, Alyssa. Or maybe I can bring him. We'll see. We'll figure it out. So, anywho, so yeah, so what we do is a completely different philosophy of medical care, which is very similar to functional medicine. So we're like the physical medicine and rehab part of that. So what we're working to do is launch an online class. We've got a lot of plans, a lot of things that we're working on. But yeah, that's the Institute. And then we onboarded a very well-known Iranian PT, believe it or not. And he's brilliant with dry needling and what he does for athletes. So he's part of our staff in Maryland now, brilliant practitioner. And we're going to get him to start teaching for us also. So we're just like, all right, we're just going to go bananas. We're just going to call it an institute and go bananas. That's the plan.
Okay, so we are at 2:57.
Yeah. Sorry.
No, this has been fascinating. But can you stay with us and maybe do a practice with us? It doesn't have to be 30 minutes. It can be 5, 10, or 15
sure.
before. Okay, good. So everybody who can stay, hey, we're going to get some mind body. And thank you so much. I have really enjoyed this.
I'm so glad. I'm so happy to be here. And again, we do all kinds of stuff. So if you want another one, I'd be more than happy. yes, Jennifer, I'm not sure when I was in Chile. It was it was probably like 15 years ago, honestly. It was a while ago. It was a while. Okay, so we can practice. So if you want to do one of the ones that people really, I think at this time in history, the limbic is a really good one. Honestly. So I would have your hands like across the bridge of your nose and your other hand across your low back. And what you would just feel for is your system kind of calming down a little bit, right? And this could be a whole conversation about behavior and what, is the driver of behavior. But everybody does things a lot of times for survival, even if their survival is actually not really, at risk at that moment. But what it will do is load your whole system. So usually when we give this, I can already feel myself relaxing a little bit. And I've been treating in my office all day. I have no reason to be in a survival crisis right now. So this is a really, really, really calming one, just to kind of open things up a little bit.
Excuse me, Lisa, is the backhand, the back of the hand on the back, or is it turned towards the back?
You can use the back of your hand because it's kind of hard to use your palm because it's hard on the shoulder, right?
Okay.
So you can certainly use the back of your hand. And then these are all meant, like if you have someone with you, you can have them help you. Like if you have a spouse or a child, you can do multiple of these at the same time. All right. The other one that tends to feel really good is the heart, because most people need a little heart loving there. So you'd put a hand in the middle of your chest, another hand across the ureters, and you'll start to feel things just kind of chill like this. All right, so I know it's a strange concept, but everything that happens in your body, there's a structural correlation to that. Every behavior, everything, there's a structure that is perpetuating that thing. And so we're structurists. So if somebody comes in with PTSD, panic, terror, whatever, we're like, all right, let's, we have blueprints and templates for all the emotions in the system. So it's like, all right, let's deconstruct that phenomenon. That's kind of calm. I'm feeling calmer. Hopefully you guys are feeling calmer. Oh, it's kind of nice, like a little hug. And you are right.
Lisa, you said that the upper arms have to do with beliefs. Did you say what the lower arms does?
The lower arms holds our belief systems. Upper arm is more like control over yourself or self-control type of thing.
Okay, thank you.
Interesting. I'm not sure how they figured that out, but it seems to be accurate.
Common?
You're very welcome, Jennifer. Great to meet you.
Is it common to feel heat coming
Yes.
off the lower back?
Yes, it is. I should have said that. So yes, so when we give this as home programs, we tell people to do you may feel nothing, but heat means that things are opening up. Your body is electrochemical, nuclear, thermodynamic. Your everything is metabolizing all the time. So when you're putting a hand there, your body's like, oh, thank God. So it's going to start to open up. So it's a sign of tissue release is the heat. Right? When we work on our clients, they often they sigh. You're going to have more GI sounds. You can feel what's called a therapeutic pulse, which is when you feel a pulse in the tissue that's not correlated to your heart rate. That's a fascial pulse release. All right. So we tell our patient, when we give this, we say, try a couple and do the one that feels the best, where you feel a lot from, do that one. Right. We have another handout, which is for physical stuff, but you can do it on an area where you have a headache, if back, you do it the area where you have pain, and usually take it to the ureters, and you should feel things opening up there a little bit. It's great for acute trauma, just to open things up. Your body is malleable and it's reactive. And if you know what you're doing, you can make a lot of things happen in the body that you'd like to have happen.
Thank you.
You're so welcome. You can relax now. So yeah, common ones, lungs, liver is a big one. We do a lot of liver processing in this town. Pancreas is also a big one. This feels good though.
do you always do it in pairs?
You want to connect two parts. So, because you're kind of creating a circuit. You're saying, do this, like drain this. So yes, you're doing two together. Now you can always, if you have one hand, I mean, the body loves to be touched. So if you smack your elbow, you put your hand on it, it's probably going to help it feel a little bit better for sure. But in this way, we're trying to connect we're trying to make something happen in the body. So you're creating a, this and this discuss kind of thing. You're trying to get them to do something as a group. Does that make sense?
Yes.
Yeah.
But usually you pair it with the urethers.
So ureters are usually our go-to because they're to drain. But you don't have to do it to the ureters. You can do it, say, to the heart is a nice one, or say the person has had well, for the emotional stuff, we usually do use it to the ureters because you're trying to drain, right? If you're doing it like, let's say somebody's liver is funky and you want to like make it stop making them so angry, you can try liver to forehead. So you can mix it up a little bit because you are creating an information exchange in those organs when you connect them. So one way, we have a video on my website where we're always trying to explain to the patient, okay, why does this work? What are we doing? And I had this one explanation where I was basically like Andy Cohen moderating a Real Housewives reunion inside the body, where the body, it's all these organs and they're like, some aren't talking to each other, some are yelling at each other. And you're like, okay, you two need to work this out. So you're connecting them and being like, heart, ureters, discuss, and it's like, come on, we need you to go. So you're just trying to basically normalize all the communication inside the body. And it's funny because there's all this research going on with like prolotherapy right now. If you guys know what that is they're instead of surgically repairing shoulders and hips and knees, they're doing that prolotherapy, which is they're shooting in the glucose and the saline. And all their research is like, yeah, the cell stopped metabolizing. The cell was like, and you shoot the glucose in there or the saline, the cell's like, oh, I need to move. I need to do this. And this is what we've been doing for 30 years is you're trying to articulate with cellular metabolism. And you can do that with the hands. You're just like, hello, let's go. So just by putting the hands on, the body's like, oh, okay. You're giving tactile information. You're trying to override whatever information happened. You're like, I'm taking control. I'm going to, reset you.
So Lisa, if we got one hand on the forehead or on the bridge of the nose or on the heart area, and with the yellow, that covers a lot of things, doesn't it?
It could, yeah.
Yeah. Okay. Thank you. I love your presentation today.
No, thank you.
So this reminds me, I was trained to do therapeutic touch. And instead of a practitioner doing it, you're teaching the person to do it themselves in conjunction with the therapy.
Yes. So funny story. So my first exposure to manual medicine was through Dolores Krieger, who developed therapeutic touch. A course that I went to with her in 1988. And she was brilliant woman. And so therapeutic touch, ironically enough, was done off body. So it wasn't actually done on body. It was energetic, right? So it was all this, and then you do it off, this. So yeah, so she knew her stuff. She was a nurse who realized that you can articulate with the body and start to get things to heal. So for me, I'm a physical therapist, so I'm used to doing more on the body. So most of what I do is on body. Sometimes if there's so much trauma, you can't get on body, and then we go off body. But usually we're on body. But yeah, she was a wonderful woman.
All right, folks, it is 3:07. I think it's okay to wrap it up. I am going to be a good girl and I'm going to process this video quickly and get it up quickly because that's how excited I am. Not that I'm not always excited, but this is something that's totally new to us. We've had an OT therapist come on, integrative OT person come on and talk about trauma, but you all are doing it in completely different ways. So that's why this has been Very enlightening. Okay,
Great.
so I will see you all next week. Misha will be back. Bring your COVID questions, your flu questions, your whatever questions, and they may or may not be answered. Okay, so enjoy your weekend. Enjoy the rain because it's part of Mother Nature's plan. Bye, y'all.
Thank
Bye.
you. Zanette, I put
Thank you so
something in the
much.
chat for you.
Okay, Lisa,
Okay, thank
thank
you.
you so much. Thank you so much. Thank you so much.
So
Thank
my
you.
pleasure. My
Okay.
pleasure.
Bye-bye.
Bye-bye.